Residents participate in a centering group as part of their ambulatory care experience. This film will show residents' video reflections demonstrating professionalism in the following categories: commitment and duty, compassion and awareness, responsiveness and sensitivity, responsibility and accountability, affection and respect.
With centering, I felt like I owned the patients. They were mine. When they came in, I said, "Oh, this is my patient." The nurses on labor and delivery would say, "Oh, is she your patient?" I said, "She is my patient. She's my girl." Different.
What I really enjoyed about centering is that you actually get to take some ownership over the patients that you're working with. You're the one that sees them for all their obstetric care. You're the one that takes care of them from the get-go, and then if you're lucky enough, you're usually the one that's on labor and delivery when it comes time for them to deliver.
And it's definitely tough to be pregnant in an environment that's not supportive. So, you know, I guess I feel for those patients just because that's what their, life is like.
Some of our patients really have no one to help them, which even solidifies even more that how they expect you to be there. Like Valerie came to labor and delivery to deliver with legitimately no one. And like I even went to them and was like, "Who's here with you?" And she's like, "Well, right now you." You know what I mean? And that was it.
Had to do with just connecting with patients, realizing that they want to know, they want to understand what's going on, and they are really interested in what's going on with their bodies and their pregnancy, and just that excitement from them and being able to teach them. I just learned a lot.
I learned that patients have a lot more questions than they really ask. If I give them time, then they'll actually come out with what they're really thinking. Whereas if I see them in this little 10 by 10 room, I go in and knock on the door and say, "How you doing?" and I'm out in 5 minutes.
So my centering experience was a very positive one. I felt I had a smaller group, so I felt like I had a very intimate connection with all of my patients that were in the group, and I felt like I really got to know them both through their pregnancy and also on a personal level.
And she was the multip of the group, the one that wasn't her first, and she was the first one I delivered. And I don't know why, I just grew a connection with her, and I wanted to see her whenever she came in, and I wanted to deliver her. And I remember telling her, I said, I have to go for a C-section in an hour, and you're 8 centimeters, so we got to do this sooner rather than later. So, it ended up happening fine, and I delivered her, and it was a great experience for both of us. So, and then I saw her baby afterwards, 6-week visit, and put everything together.
I mean, even just with like Gloria, for example, like even when she would go for her NSTs, like she knew that I was on the floor that month, so she would have the nurse call over and she'd be like, "Tell Dr. O'Brien I'll be over within like a week and a half to deliver, and he better be there." Like just little stuff like that, which is nice.
It's kind of funny you said. I actually went to Walmart the other day and bumped into one of our patients, and how I bumped into her was she actually came up and hugged me, and just thanked me again for the experience in taking care of her in the centering group. And then I was actually lucky enough to be able to deliver her too. It was very nice.